Hi, my name is Kevin Moss. I'm a senior editor with Consumers Checkbook. We publish Checkbook's Guide to Health Plans, which helps federal employees and annuitants choose the right FEHB plan. Today we'll talk about Medicare Part D and why most federal annuitants will benefit from Part D coverage for their prescription drugs. This year, OPM allowed FEHB plans to begin offering Part D coverage to Medicare-eligible enrollees. To be included, the Part D plan must provide prescription drug coverage that, when combined with an existing FEHB plan, is as good or better than what's available through the FEHB plan alone. 17 FEHB plans offered PDPs to their Medicare members in plan year 2024, and next year, that number will increase to 20. Not only are there more options to choose from, but there are also benefit changes that will make Part D more convenient and a better value. I'll walk you through the key updates and help you figure out how to determine if Part D is the right fit for your prescription drug coverage. Note, starting next year, USPS annuitants and their covered family members will receive healthcare benefits through the new Postal Service Health Benefits Program, or PSHB. PSHB Part D rules differ from FEHB, so these recommendations do not apply. The first thing to know about PDPs or PDP EGWPs, they must provide equal or better coverage than what's offered by the FEHB plan. This includes both the drugs covered and the out-of-pocket costs. From OPM, FEHB annuitants enrolled in an EGWP must have formulary access to all drugs covered under the corresponding FEHB formulary at the same or lower cost share than they would have otherwise been responsible for if they enrolled solely in the FEHB plan. Medicare enrollees in FEHB PDPs may have access to drugs not typically found in commercial PDPs. For example, GLP-1 weight loss drugs can only be prescribed to treat conditions like heart disease or diabetes in commercial PDPs, not weight loss. However, OPM requires coverage of at least one GLP-1 weight loss drug, and that extends to PDPs. Last year, I spoke with many federal annuitants who disenrolled from Part D because they noticed higher prices for the same drug dosage in pharmacy in the PDP compared to their FEHB plan. But this year, it seems like that's not the case. In fact, in some cases, I'm seeing significant savings in the PDP plans. OPM has encouraged carriers to implement innovative solutions to help enrollees better understand prescription drug benefits. So, comparing coverage between your FEHB plan and the PDP should be easier this year. Make sure you know how your current prescription drugs will be covered by the PDP. You may find that the PDP is providing lower prices than your FEHB plan. Starting next year, all Part D plans will feature a $2,000 annual cap per Medicare enrollee on out-of-pocket prescription drug costs. This new limit offers significant relief to federal annuitants with high prescription drug expenses. However, it's important to note that FEHB plans vary in how they apply PDP costs towards the medical catastrophic maximum. In some plans, out-of-pocket PDP costs will count towards both the medical and Part D catastrophic limits, while in others, these costs will only count towards the Part D limit. Be sure to review your plan's specific rules to understand how this may affect you. Medicare is also introducing a new prescription payment plan, which allows enrollees to spread their out-of-pocket costs throughout the calendar year. Enrollment in the payment plan is voluntary, but it could benefit those expecting more than $2,000 in out-of-pocket costs, particularly if they reach the limit early in the year. Medicare provides a website where you can learn more about the payment plan and determine if it's right for you. Those interested in enrolling should visit their FEHB carrier's website for details on opting in. The following 20 FEHB plans will offer PDPs to their Medicare enrollees next year: Aetna Direct Consumer Option, Aetna Open Access High and Basic in the Mid-Atlantic area, APWU High, Blue Cross Basic, FEP Blue Focus and Standard, Compass Rose High, Foreign Service, GEHA High and Standard, Health Partners High and Standard, MHBP, the Consumer Option and Standard and the Value Plan, NALC Consumer Driven and High, Samba High and Standard. Annuitants in these plans who have either Medicare Part A or Parts A and B will be automatically enrolled in the PDP. Your FEHB plan will send you a letter confirming your eligibility and automatic PDP enrollment, along with instructions on how to disenroll if you choose. If you disenrolled from Part D this year, you will not be automatically enrolled next year. If you wish to enroll in Part D for the upcoming year, you will need to contact your plan directly. Annuitants who currently receive prescription drug benefits through a PDP and wish to keep their current FEHB plan do not need to take any action to maintain the same coverage next year. While most federal annuitants will benefit from Part D coverage, there are a few situations where you may not be better off. While PDPs offered by FEHB plans don't have an additional premium, individual tax filers with income above $106,000 and joint tax filers making more than $212,000 are subject to an income-related monthly adjustment amount, also known as IRMA. In the first IRMA tier, this would add $13.70 a month to the cost of Part D enrollment. Federal annuitants subject to IRMA will need to evaluate the potential Part D benefits against the IRMA surcharge when deciding whether to keep Part D. Having Part D disqualifies you from using pharmaceutical manufacturers' coupons. There is a U.S. anti-kickback statute that makes it illegal for individuals enrolled in Medicare to use drug discount programs. If you currently use one, and the value of that discount is worth more than potential Part D benefits, opt out of Part D. Like original Medicare, Part D does not provide international coverage. If you live abroad or spend a lot of time overseas, you may opt out of Part D and maintain your FEHB prescription drug coverage. If you're just traveling overseas, consider keeping Part D. To help with the PDP's lack of international coverage, you could obtain travel insurance that pays for medical expenses not covered by your health plan. Most federal annuitants will benefit from Part D coverage and should keep it. This is especially true next year when all Part D plans will offer a $2,000 maximum out-of-pocket limit, a prescription drug benefit not found in FEHB plans. If you live overseas or heavily use pharmaceutical discount programs, Part D will be of limited value, and you'll likely be better off with the prescription drug coverage from your FEHB plan. Federal annuitants subject to IRMA will need to determine whether the surcharge outweighs Part D benefits. Thanks for watching. Please like and comment so more federal employees and annuitants can find this video, and make sure to subscribe to our channel to receive alerts on future videos.